course, one should take into account the mental aspect of the operation. So most surgeons in the world concentrate on minimizing the aggressive nature of the surgery, and this will contribute to the recovery of the patient. It will enhance the mobility of the patient in the post-operation stage. Less blood would be used, and this would also minimize the risk of infection.
Dr. Nouri, could we have your views, sir? In what way, in what other ways could you add to what Dr. Mahmoodi said, that this particular is other heart surgeries? Any other points that you wish to raise?
Well, the surgery is fantastic. Of course, it is very difficult for the surgeon to do it, but for the patients, the result is unbelievable. The patient Dr. Mahmoodi did was released 3 days ago. Only the hospitalization was 3 days, and he's at his home right now in Shiraz. Of course, the only thing I would like to add to this discussion is that you don't have that big scar surgery. The patients every day, when he sees himself at the mirror, he doesn't see that big scar, and psychologically this is very important. Right. And of course, women also, this is very important. Plus, the patient has less pain, less drug is used, and bleeding, the blood transfusion is a big problem these days, and the patient has almost no blood transfusion through the surgery. Well, I hope in future we can do more kind of this surgery. Okay. And the adhesion of this surgery, as Dr. Mahmoodi says, is very less. You hardly see any incision on the patient's chest.
Dr. Nouri, you just said that the patient, Dr. Mahmoodi's patient, was discharged after 3 days. What is the normal hospitalization period for a normal bypass surgery?
Usually between 5 to 8 days.
5 to 8 days.
Usually, yes. And
Right.
the very painful process. As far as I know, this patient hardly had any pain, and we hardly used any narcotic for this patient.
Thank you.
Thank you.
Dr. Mahmoodi, I've been told the patient whom you operated on was your brother.
Yes.
How did it feel to actually perform the first of this kind of operation on your brother? Tell us about your feelings.
من فکر میکنم که اگر متدی رو
Well, I think that when the surgeon is certain about the type of method he's applying in the course of the surgery, he can also make use of that method, conducting an operation on one of his relatives. And of course, my brother is like other patients. I did not have any particular feeling towards my patient. It doesn't make any difference whether the patient is my brother or
for
not.
any reason? No.
No, I did not feel nervous.
Dr. Mahmoodi, as you said, as you briefed us at the beginning of the program, you've spent many years, I've been told some 30 years in Germany, and you're currently at Lübeck University. And I've been told that you've actually invented certain surgical tools which you use in your operations. Tell us about these surgical tools that you have invented, and how did the need arise for you to think of inventing these tools?
Speaking of in the career, I worked and conducted research on aortic valve, and I focused on the changes of aortic valve, and I registered that that is what I call the biological aortic valve. And secondly, I can referred to patenting an instrument for recovering the mitral valve ring, and there was